And I don't use a single drug from Rasa Shastra. In my 26 of year practice, I have not used Suta Shekar, no Kamduda, no Aragyavardhini, nothing. No Bhasma, no Dhatu, no metal. Because it is not Ayurveda. Rasa Shastra Bhaishya Kalpana is not as per Ayurvedic Bhaishya Kalpana. It is undue adulteration with Sahitokta medicines by Rasa Shastra. Okay, that is different subject. Next. I use this. You know these first three lines for Rasa Shastra. Alpamatropayogi syad, arucherna prasangata, kshipramarogyadayi syad. You know all this that. Oshadibhyo dukho rasa. No, I converted that saptadha bhavita vati. I will explain in 1 minute and I will stop. Okay. The Sanhita practice, the Charak practice, the Vagbhat practice is much more dominated by Kwatha. If you want to prepare Siddha Taila, Siddha Gruta, you have to prepare Kwatha. If you want to prepare Avleha, you have to prepare Kwatha. The dominant Bhaishya Kalpana in Sanhita treatment is Kwath. But it is impossible to dispense the Kwath in our OPD. So we tend to give Churna. And for Kwatha, you have to have the Churna first. So the basic ingredient of Kwatha is again Churna. And Churna Matra is 10 gram, 1 karsha. Gutivati Matra is 1 karsha. Kalka Matra is 1 karsha. And it is impossible to dispense 1 karsha Matra to the patient because 1 karsha is 10 gram. Is it possible to give 10 gram, 1 dose to this patient? What is the tablet size that you deliver to the patient? 250 mg or 500 mg. Correct? So, if we want to deliver 10 gram of dose, matra kala shraya yukti, correct matra and correct duration, how many days you should give treatment for the given complaint? That estimation you should have. I have that estimation that I just claimed. Minus 5.4 from the HbA1c figure. The remnant is the time required to get corrected up to 5.4. Those many months. So if I want to give 10 grams of churna to the patient, it is not possible because I will have to deliver 40 tablets of 250 mg. 1 gram is 250 mg, 4 tablets. For 10 gram, I have to give 40 tablets. 40 tablets, how will you consume at one time? Then he have to get a pan, put the tablets, put some pads, put some lasun, chok laga ke usko aise khana padega usko. So why do we don't get results? Because we don't deliver, we don't dispense the medicine in Sahitokta Matra. And if we want to give in that Matra, it is not possible practically. So I went for Saptadha Bhavita Vati. It is not by my mind. I don't do anything by my mind. Nothing Kapola Kalpit. Everything is na matra matram apyatra kinchid agama varjitam. Na matra matram apyatra kinchid vagbhata varjitam. चरक ने कल्पस्थान 12 में श्लोक नंबर 47 में लिखा भूयश्चैषाम बलाधानम कार्यम स्वरस भावनैः ही. उसी चूर्ण को उसी चूर्ण के क्वाथ की भावना दे दो. सुभावितम अल्पमपि द्रव्यम स्यात् बहुकर्म कृत. सुभावितम अच्छी भावना दिया हुआ अल्प द्रव्य भी बहुकर्म करता है. सो आई गेव 7 भावना of that same churna to same kadha. So 3 kg of Vachaharidharadi churna, 21 kg of Vachaharidharadi churna were decoction. And that decoction of 21 kg of Vachaharidharadi churna was absorbed into the basic 3 kg Vachaharidharadi churna. So how many time fortification is there? Saptadha baladhana, bhuyashchaisham baladhanam. Now the churna is 7 times fortified. So you don't need to give 10 gram. Divide 10 gram by 7, it is 1.5 grams. Divide 40 by 7, it is 6 tablets only. Now 6 tablets is very easy dose to consume. And we give 6 tablets 3 times or 4 times depending upon the sugar and HbA1c and the age of the patient. And it will give results within 14 days, 1 month, 3.5 months, 100 days. As per your expectation, as per your challenge. Next and last. So I will explain all these things in my second lecture. Because for second lecture, the subject is short. Diseases other than diabetes and obesity, which are lifestyle oriented. So I have shown some glimpses of those diseases. So those diseases are few. And the matter to be discussed on that is for shorter time. So I will cover all the remaining slides of this diabetes and obesity, Nidana, Lakshana and Chikitsa, and how do we approach to Vacharidradi or Trifala Abhaya. We will explain it in the next lecture. Thank you for your patient listening.
Hello. Questions are invited from the audience. Yeah.
Hello, sir. Sir, you had shown on the WhatsApp picture that reduction in the weight, obesity patient. You told you have not seen the patient. Without seeing the patient, how you have adopted Nidana Panchaka in that patient, sir?
I will explain in my next lecture, sure. बोलो. बताता हूँ, वही बताता हूँ. वो कृष्णप्रमेय में क्या होता है कि ड्यू टू एलिवेटेड शुगर लेवल्स उसका मसल लॉस होता है, प्रोटीन लॉस होता है, जिसको हमारे यहाँ बलमांस क्षय कहा गया है. क्या कहा गया है चरक में? बलमांस क्षय. और बलमांस क्षय होने पर केवल डायबिटीज़ या प्रमेय नहीं, any patient will deteriorate. So I will take care of my every patient that he will not go into protein loss, any muscle loss, any malnutrition, any balamansha kshaya. How? It is from the diet side. I will explain that while explaining the obesity treatment also. Okay?
ट्रीटमेंट के साथ बल मांस का
वर्धन भी किया जा सकता है. वो मेरे पेशेंट्स ऐसे हैं कि जिनका वज़न 1 किलो भी कम नहीं हुआ, लेकिन जिनकी पूरी टमी चली गई, पूरा फैट लॉस, पूरा का पूरा पेट जो है चला गया, और उनका जो डायबिटीज़ था वो भी चला गया. देयर आर साइड बेनिफिट्स, देयर आर नो साइड इफेक्ट्स.
Okay. Shall we conclude? Yeah. Nice lecture by Balakrishna ji, because it's a thought-provoking and very innovative idea, sticking on to the Samhita. But lot of people in their minds, they have lot of apprehensions also. But once we see the next lecture, we'll be knowing how this can be executed in the day-to-day life. But my question actually, I do not ask to, I should not ask. But any lifestyle corrections are done by these patients? Any diet and exercise?
I don't believe on the policy that drug and disease, though I just emphasize on Vacharidradi preparation. But the treatment is always as per Ashtangrodaya Nidan 1. It is Aushadhanna Viharanam Upayogam Sukhavaham. It is Aushadha Anna Vihar, and for diabetic patient it is report. So I will give that shloka which I have converted. Aushadhanna Viharanam Upayogam Sariportakam. 4 things are necessary. Aushad, Anna, Vihar. Vihar means exercise. Aushad means that care of that, not to lose any muscle, not to lose proteins, not to lose our bala and maunsa both. So I will explain what diet is suggested for nashta, for lunch, for dinner, all these things. Okay. What exercise is correctly suggested to them, and how we go for the recurrent reports for the follow-up in the due course, and how we go for the last HbA1c report on 98th day, 90th day. Okay. So okay. All these things will be explained about diabetes, obesity and other diseases also.
Okay. Let us conclude because the time is running short. The people are waiting for the dinner, the lunch also. So let me give this microphone to our chairman to conclude.
Thank you, Dr. Mahatre, for your lecture. So now we should follow the next speaker. Na?
break for the lunch, sir.
Now is the last break. Okay. So, what's up?
Thank you, sir. We would now like to felicitate the speaker, Dr. Rishikesh Balakrishna Matreji. I request our student representatives and Dr. Bishnu Chaudhary and Dr. Mridusmita Sood, the faculty, Department of Sharikriya, to come and felicitate him with a Fulam Gamusa and a memento. I think this was a very valuable presentation. So Needed a big round of applause. Thank you. We would also like to felicitate our chairs. We would first like to felicitate Dr. Murli Krishnaji, Dr. P. Murli Krishnaji with a Fulam Gamusa and a memento symbolizing the Assam rhino. I request Dr. Mridusmita Sood to do so. Thank you. We would like to felicitate our ever-loving chairperson, Dr. Pradeep Kumar Goswami, sir, with a Fulam Gamusa. Thank you, sir. Your presence is always encouraging. We then break for our lunch for 30 minutes, as has been told to me, and then we come for the next session. We felicitate sir with a Fulam Gamusa. Thank you, sir. Thank you.
So, I invite, as the chairperson, I request the coordinators to start the session, and I request Dr. Balakrishnan sir to continue. Sir, please. Yes, sir. And I request the speaker, all the speakers of this session to stick with the time, because we are lagging behind and we are to finish at our target. So please, sir, please.